Madam President.
The senator from Arkansas.
Thank you, Madam President. Surprisingly, the President didn't talk much about Obamacare, his, quote, signature achievement. The people of Arkansas, the people of America certainly are talking a great deal about it, and they're writing a great deal about it also. And the reason being is that they're so concerned that health care has become an absolute mess. The President talked about a single mom that was able to resolve the problem of her pre-existing conditions. And I think that we all agree that that's something that was desperately needed. I'm an optometrist, an eye doctor, and very much aware of the situations that people have been put in the past. The reality is, though, that we can fix this problem, problems like this, without creating a massive bureaucracy, without creating a situation where we have thousands of pages of regulation. And the reality is the unintended consequences of the situation that we're in now with Obamacare is we've made it unaffordable. We've made it such that millions of Americans simply can't afford the health insurance that they're being offered. Let me talk about a few that where people have written me and talked to me about. This is Jack from Springdale. I just found out recently from my health insurance provider that my current health insurance policy will be discontinued effective the 1st of next year, and a replacement policy will be approximately double, which will be around $1,200 per month. My question is this: what is Obamacare supposed to do about that? And if not, what can be done to fix it? Here's Leonard and Joanne. This letter comes to you to ask for your needed support to defund the Affordable Care Act in any way possible. We recently received notification from Health Advantage of Arkansas that our 2014 monthly premiums increased to $173.70 for a total of $1,360. Our out-of-pocket max increased from $3,000 to $5,000. The primary care physician copay increased from $25 to $35, and the specialist copay increased from $35 to $70. If either of us has to visit the ER, that copay increased from $100 to $250. The drug copay also increased. We're insulted to have to pay for benefits such as maternity, pediatric dental, drug rehab, which we have no need for since we are in our 60s and do not use drugs or alcohol. Health Advantage of Arkansas explained that these changes to our policy and increased cost were due to compliance to the Affordable Care Act. We have supported you in the past and would like to know what your plan is to relieve Arkansans and other Americans from these additional finance burdens imposed upon us by the Affordable Care Act. Mary in Little Rock writes that she received a notice that her MedPAC Advantage plan was canceled at the end of last year. She explains, "I had no idea that Obamacare was going to also affect Medicare. Now to receive comparable coverage for 2014, I will have to pay an additional $500 plus in premiums. This additional cost will definitely place an unfair burden on my finances. What are you and the Senate going to do to correct this situation?" I think Mary asked a very fair question. What are we going to do to correct her situation, the situation of so many others? And I think the answer is that we need to repeal Obamacare. We need to put in place a system that does take care of the problems that we have, but without the bureaucracy, without the tremendous expense, and make health care affordable for all Americans. I yield back.